Hello, welcome everyone to another episode of the Kotal Health Conference. My name is Raphael Pali. I am going to be the moderator today. The Kotal Healthcare seeks to find innovative ways of improving healthcare in low-resource regions in Africa and all over the world. And we do this in collaboration with stakeholders and other interested bodies. One of the ways that we do this is through dissemination of knowledge and presentations like this. So today, we are going to have an awesome presentation by one of our very own partners and members, Dr. Nnamdi Elenwoke, who is a neurosurgeon at the Neuro Institute in Barcelona. He has extensive experience in minimally invasive surgery and robotics in functional neurosurgery. His work at the Kotal and the Rotary Club has touched a lot of lives. And his recent featured interview at the Rotary Club, entitled "A Little Bit of Salt," has been a source of inspiration for many people, especially in the target population the Kotal has been working with. So I will invite Dr. Elenwoke to come and enlighten us a bit more about head injuries. Over to you, Dr. Nnamdi.
Thank you very much, Dr. Pali. Today, we are going to learn about head injuries. And of course, head injuries are very important because we see them once in a while. It can be you, it can be your family member, or it can be someone that you don't even know. And with this presentation, you have a better idea of what you can do. You might be a doctor or you're not even a health worker. But after this presentation, you know that you can do something about it. Now, one day I was driving back. I was going home. On the highway, I saw an accident. I had to stop by, and people also stopped by. And we saw a car, a driver, an unconscious driver, and we are trying to pull the driver out of the car. So, of course, I called for help. They called the ambulance, and we'll try to bring the driver out of the car. So we'll put the head straight so I would not move the head in a position that is not good. Then we put when the ambulance came, the ambulance took the driver to the hospital. Then some days later, I heard that the patient is okay and right now he's at home. So this is a situation that some of us can encounter. Maybe some of us have even encountered this kind of situation. Now, but you have to understand that brain injuries, they are treatable. Most times they are treatable. In fact, the majority of the time they are treatable. But if you don't treat them, it can cause problems. It can even cause some mental or emotional changes in someone. Okay, so it's very important to treat it if you encounter this. Okay, now, but when you get to an emergency situation, what do? I've outlined here 3 things you have to do. With these 3 things, you will be sure that you will be doing something already. Okay, so the first thing you have to do when you see an emergency situation is to check for danger. Okay, so you check for danger and you look around you to see whether everything is fine. Then if everything is fine, maybe if you see, like my case, maybe the car will explode. You don't know what will happen next. Okay, so you just check for danger. Then you call for help. In some cases, you can call an ambulance, you can call a neighbor to help you, or even if you're in a remote place, you might not even have time for doing this, then you can just go to the first aid care. Okay, but sometimes everything comes automatically, but you have to be organized. You don't have to be shouty, you have to be nervous. You just do these 3 things, okay? So that when the help comes, at least you have done something to save someone's life, okay? Now, talking about the first aid care, I would like you to watch a wonderful video that was presented by Dr. Uche Odunze. It was about the importance of basic CPR. So he talked a little bit about first aid care. So you can go to YouTube and type his name and you watch this wonderful presentation by Dr. Odunze. Now, I usually quote something to people. I tell people that even in surgery, that one of the best ways of preventing an accident is knowing that it can occur. Okay, so I tell people this, maybe you are driving, you know that something can happen then that's one of the best ways so that people will have that thing in their subconscious mind. Okay, now let's continue. Now, there's what they call Glasgow Coma Scale. Now, this is what doctors use rapidly to know how a patient is, okay, especially in that first aid care, to know how a patient is. And you can report this to another doctor. It has like 3 points, okay? The main one is how the patient is opening the eye, how the patient is talking, and the last one is how the patient is moving, okay? So the Glasgow Coma Scale has 15 points. It's 15 points, and the minimum of 3, okay? So the top point is the 15. When the patient is like normal, like the normal brain injury, most brain injury you see, they are like GCS of Glasgow Coma Scale of 15, okay? So they open their eyes, they're orientated, they can talk very well, and they can obey commands. And when the patient or the victim or the accident victim is very, very bad, the worst you can see is 3. 3 is literally that the patient is more or less very bad, okay, in a very bad shape. Now, so Glasgow Coma Scale is what you can use to rapidly know how someone is doing, okay? Now, another thing that you have to go home with is this, okay? Whenever you call a neurosurgeon to come and evaluate a patient, especially in the hospital, there's one of the things that they will do, if you notice, is that they will use a torch, maybe with their phone, light, and shine your eyes, okay? Shine the eye. Now, why do they do this? Because there's what they call pupil. You know, you have your white part of your eye, then you have the blue or red parts of, or the green, depending on the type of eyes the person has. And in the center, you have like a black part. Now, this black part is called pupil, okay? It's like the gateway to the brain. Okay? The neurosurgeon, with the way the people behaves, you can know what is happening more or less in the brain. So when in a normal shape of the pupil is like what you are seeing in the photo, okay? It's like more or less small. Now, when you shine light, the pupil will get smaller. Then when you remove the light, the pupil will come back to normal shape. But in some patients that have, you shine, when you open the eye, you just see that the pupil is big. Okay, they call this mydriasis, but it's just big. Now, when you shine light on it, it does not shrink like normal. So this is telling you that something happening in the brain, especially one part of the brain. Now, but when you see this in the 2 eyes, then that is it's not a good news, okay? So when you see the pupil big in the both eyes, it's not good news in this case, okay? So pupil is very important, especially for evaluating any patient. Now, after you have passed that evaluation part and doing more or less one of the first things, if you have access to a hospital, you just go straight to the hospital. And if the patient is grave, remember the Glasgow Coma Scale, okay, you might do a CT scan, okay. Sometimes you might do blood tests, or you might want to do X-ray. X-ray for the head is not quite important. So what you just have to do is a CT scan. Just go straight to CT scan, okay. CT scan can be done in 5 minutes or even less, okay, to know what is happening in the brain. And when you do this CT scan, you are going to see a lot of things. But there are 4 things you have to go home with. Okay, number 1 is the concussion. So in concussion, it's majority of head injuries, their slight head injuries are just concussion. They just hit your head. Most times, if you do a CT scan, you don't see anything. The patient might have headache and all those things, but you might not really see anything. Now, that's number 1. Then number 2 is like contusion. It looks like concussion, but it's like a lesion on the brain. Okay, that the brain has a little bit of blood, okay, on the surface. So sometimes doctors can say subarachnoid hemorrhage or traumatic. So in this case, you might just see some white something in the CT scan. Okay. Now, in that case, the patient might have more days with headache or trying to vomit, you know. But in most times, the patient will recuperate in 1 week. Okay. Now, another one you can see is skull fracture. Most skull fractures are simple. You don't have to be scared when you see skull fracture. Most skull fractures are simple. They don't cause too much problems. Okay. Now, but you can have skull fractures that are complicated. Now, sometimes the skull fracture that is complicated you might see number 4, okay, which is hematoma. In hematoma, it can come, like I said, with skull fracture or no. It's just a blood clot in the brain, okay? So depending on the size or the conditions of the patient, it might require or not surgery. So more or less, this is what you can see. The other things you can see, but with this basic information, you know what is happening in the brain. Now, let's jump to treatment. So what happens in treatment? In treatment, you have to divide the patients into two, more or less, or three. Well, some people are just mild, and the other ones are like severe. In the mild cases, okay, you just use like your normal painkillers, some rest, and you have to monitor. This monitoring is very important, okay? So because I had a case of a patient, of a lady of 26-year-old lady. She had an accident, and she was in the hospital. She wanted to go. We told her to just wait. We'll see because she was feeling very well. Okay. So after like 12 hours of being in the hospital, her conscience level, the Glasgow that I said before, started to decrease. So we had to do her a CT scan, and we just saw a blood clot. This time around, it's like epidural hematoma. Okay. And we had to do the surgery immediately. So that is why monitoring is very important. Okay. Even if that person wants to go home, you should stay near a place that you have maybe a hospital, or you don't allow the patient, depending on how the doctor is in the emergency room, you might allow or not allow the patient to go home. And depending on whether the injury is mild. Then when it's severe, now this one is a bit different. Now when it's severe, you have to give emergency care. You might need ICU. Okay. It might even require surgery. Okay. We call neurosurgeons to do some surgery. And later on, this patient might also require rehabilitation, maybe to move the limbs. Maybe the person will not be moving the hand or the leg, or even have speech problems. Okay, so might require rehabilitation. So this is very important to distinguish the two. Okay, whether it's mild and whether it's severe. Now, I make videos. Okay, animation videos about health. So I made one so that you can watch. And you tell me, we'll just watch the video and then we'll finish. Okay. So it's just more or less a summary of what I've taught. Okay. So let's watch this video.
As soon as I got to the accident site, I saw a car that went off the road and hit a tree. We have been 1 hour in the traffic. Some people were trying to pull out the unconscious driver out of the car. I helped them pull out and then laid him on the ground before the ambulance took him to the nearest hospital. According to the World Health Organization, nearly half of those who die on the world roads are vulnerable road users, pedestrians, cyclists, and motorcyclists. There are 4 types of brain injuries: concussion, contusion, core fracture, internal hematoma. These are some of the things you can do when you encounter someone with brain injury. CPR. See this presentation to learn about cardiorespiratory resuscitation. Bleeding. Apply direct pressure on the cut or wound with a clean cloth, tissue, or piece of gauze until bleeding stops. Healthcare. Keep the head in line with the spine and prevent movement. Wait for medical help. Seizure. If you are with someone with convulsion, try to stay calm and remain with the person. If they have food or fluid in the mouth, roll them on their side immediately. Keep them safe and protect them from injury. Treatment. Brain injury from trauma results from 2 distinct processes. 1. Primary brain injury. This occurs at the time of the trauma. It can be cortical contusions, lacerations, brain fragmentation, diffuse axonal injury, and brainstem contusion. Then you have secondary injury. This develops subsequent to the initial injury. It includes injury from intracranial hematoma, edema, hypoxemia, ischemia, etc. Since impact damage cannot be influenced by treating the resurgence, intense interest has been focused on reducing secondary injuries, which requires good general medical care and an understanding of intracranial pressure. When you see someone with mild brain injury, the person should follow the following recommendations in the next 24 hours. 1. Relative rest at home. Number 2, the person taking care of this patient should assess whether he speaks well and whether he can move his arms and legs normally, at least for the next 24 hours. Number 3, you can ingest liquids and solids in small amounts. Number 4, if you take any previous treatment, consult your doctor. It is normal for a mild headache to appear, which will last up to 24 to 48 hours. Number 6, apply ice to the trauma without direct contact. with the skin. Meanwhile, you should go to the emergency department if you have any of these symptoms. Severe persistent headache, which does not go out with painkiller, sudden or persistent vomiting, abnormal tendency to sleep or difficulty waking up, inequality in the size of the pupils, loss of consciousness, confusion or disorientation, difficulty speaking or expressing oneself, progressive balance disorder, double or blurred vision, loss of strength or mobility in any limb, seizures or convulsion, appearance of blood, watery liquid from the nose.
Okay, so you can go to YouTube and you can see more of these videos. Okay, so let's finish. So thank you very much, Dr. Tal, for this wonderful opportunity of being here and making this presentation on what you should do when you see head injuries. Of course, I'm available on social media, on Facebook, on Twitter, Instagram, and we even talked about YouTube and LinkedIn, of course. And this is my email and this is our website. You can get in contact with me anytime you want. Thank you once more. So I'll be waiting for your questions.
Thank you very much, Dr. Nnamdi. That was a very wonderful presentation, concise and precise. And yeah, it was a very good one, very educative. I think the most important thing most of the time with head injuries is that it's good to have like a good orientation and then be calm, as you mentioned, because most times when people see an injury on the head, that is scary enough, and that makes the person forget a lot of ways they could approach the situation. So yes, thank you for the style of presentation too. So just a couple of reminders. Head injuries are classified into 4, and there is a lot that we can do. It's also interesting that head injuries many times don't happen in isolation. So it could be polytrauma or from convulsion or whatsoever. So it's interesting. It's important too to also know how to do CPR and how to handle the other conditions that come with it. I have a question here. So we have time to answer a couple of questions. I have a question here about what are your thoughts about how best to approach head injuries, especially in low resource regions, especially where Dr. Tal is working in. What is the advice that you would have for somebody in a community, in a community where there is no hospital or an ambulance to send the person in? What do you suggest? Your thoughts about that, Dr. Nnamdi?
Okay, thank you very much. Now, I've seen this kind of situations in remote areas. Okay, now that is why, like I said before, you have to do a rapid evaluation of the patient. Now, you might need some help, okay? You can't do everything, but you have to do something about it. One of the ones that we encounter is the bleeding one, okay? So in the bleeding one, what you just have to do is just to try and join the wound, okay? And then press. Most times the bleeding stops or decreases a lot, okay? Now, another thing you can do in an unconscious person, like the video of Dr. Oduns, I said, you can raise the person's head so that the person's legs, so that blood can flow to the brain, okay? Now, you try not to push the head around, okay? And then while you wait to see what you can do. Now, but if the patient has a hematoma, a big hematoma, and you don't have equipment, it might be difficult for you to do something. And if you don't know what you are doing, if you're not a neurosurgeon, if you're not trained, it might be difficult for you to do something. But with this, in most of the cases, you will just resolve the problem. Thank you.
Hey, thank you very much for that answer. Thank you, Dr. Nnamdi, for a concise answer there. But we have a question too from one of our partners. So they mentioned here that in situations where they have they don't have a neurosurgeon in the community where they are working, and is there a suggestion of where to refer their cases in, and where to refer their cases to, and if you could give a bit more information on how to go about referring this patient, because it seems this person works in a place that is a bit remote.
Okay, so in these cases, in some places, what we'll do is like we have trained some general surgeons in handling some of the cases. Okay, there's what they call exploratory boreholes. Okay, this is where when the patient gets to a hospital and you don't have something like a CT scan and the patient is going to like die, and but you have at least a surgeon, and you want to do something as soon as possible. So sometimes they can just do some exploratory borehole, or maybe just to open a part of the brain so that the blood can gush out and relieve some pressure from the brain. Now, another thing is when most hospitals, most doctors, or some places where you see this kind of things, or people that fall from the ground, you have to know where you have other doctors, okay, so that you won't start, like in my case, in some parts of Nigeria, for example, I know where the neurosurgeons are. Okay? So, but as a doctor, you are supposed to know more or less where to refer patients. Okay. Then, if you cannot refer patients, you don't even have mobile phone or anything, then you do these steps. Okay. But because you can't do everything, like I said before. But if you can refer, that would be good. Now, remember that most cases, you don't refer most of the cases. Most of the cases that you see are the mild ones. Okay. The minority are the very bad ones. So in those bad cases, you might need some help. Thank you.
Okay, thank you very much for that answer. Finally, we have a question here from one of our partners' son. Dr. Nnamdi, you've been a great inspiration to many people, even outside of medicine. So it seems you have a fan here who's asking that where would they, I think they want to become a physician. How can they get to learn more about head injuries and how to help people? So like, I think basically this person is just asking how to follow this career, how they would be great, they will be a neurosurgeon in the future and things like that. Yeah.
Okay, I remember in doctortal.com in 2016 or 2017, I wrote an article on how to be a doctor. Okay, because for you to be a neurosurgeon, first of all, have to be a doctor, and you then decide what specialty you have to do. Okay, it's not rocket science. You just have to be disciplined and read a lot, and then you can get it. It can be tough. It depends, especially you have the country. There are many. It can be tough. So, but you can still do it. Okay, it's not impossible. Then, if you want to, there are a lot of books now. There is over information. So, there are a lot of medical books that are very good in this. Okay, they will explain it for you. There are websites you can get information from doctortal, like I said, .com. You can get in contact with me. There are other websites like WebMD or Manual Merck, so you get more information on this. But of course, you have to go to specific places to get this information. You can't just go to anywhere and get this information. So with this, you don't need too many websites or too many books, just one or two things, and you are good to go. Thank you.
Okay, thank you very much. One final question here. Sorry, I remember I said that was going to be the last one, but I think this will be interesting to take. So I'll just read it out directly. when we're in a situation where there is no access to MRI, what other investigations can be more easily done to assess the patient who has suffered a head injury? I know that you've spoken about this, but probably you could say something about this. Thank you.
About what? About the
when they don't have MRI, access to MRI, what other tools do they have to assess this patient?
Okay, so instead of MRI, there's a difference between MRI and CT scan.
CT scan, exactly.
Yeah, so the MRI is different. That one is like it's magnet, okay, and it's more or less it's physics. So the CT scan is like X-ray, but very high dose, okay. So when you see a CT scan, it's different, and CT scan is usually cheaper than MRI. People confuse it, and the MRI sees maybe the tissues, but CT scan will see the bone and quickly see the blood, because the CT scan can take less than 5 minutes, while the MRI can take 20 minutes. But that's another story. Okay, so if you don't have MRI, just CT scan. If you don't have CT scan, then it can be difficult. So you have to evaluate very well the patient. In fact, evaluation is very important. Okay. Then after that, you can decide or not the complementary exams. So now, before the CT scan came in, doctors used to do like what they call arteriography. Okay, that can be difficult, but they used to, like here, when you didn't have CT scan, so they would just inject a contrast in your blood, and the thing will just show more or less what is happening in the brain. So, you more or less understand what is happening. It can be dangerous, but they don't do that right now. But that's something that can be done to quickly know what is happening. The X-ray will not give you a lot of information, but I always insist on physical examination and monitoring the patient. In some cases, you know what is happening, okay, when you evaluate these patients. But if you have a CT scan, you have more information, of course. Then remember, if you're in the hospital, you're not alone. You have other doctors. You might have people that are in ICU. You have people that are in emergency, okay, and you can put heads together to know what action to take, okay. Remember, in the grave ones, there are other things you have to also check. You have to stabilize the patient. Okay, maybe the patient is having high blood pressure or even low blood pressure because of too much bleeding, or you have to check the blood sugar and all those things. You have to stabilize these patients. So that's why people that have equipment, they go to neurocritical care, because these patients are special, more or less patients, okay, in this case. But like I said before, the majority of them are not in this case. The majority of them is the ones that we see every day. Maybe you just hit your head on the wall, or you just start to be dizzy. And that is what you are going to see. The majority of them is what you are going to see every time. But when you get to the accident one, then you have to take the steps, and that's it. Thank you.
Yeah, thank you very much, Dr. Nnamdi. Just as you rightly said, let's not throw away the most important part, which is actually taking history and examining patients. I am sure that is one of the greatest joys of being a doctor, that you're able to even to do these assessments with physical examination, with history, before even looking for complementary tests like CT scan and the rest. I understand that this topic usually makes people a bit nervous, and so they start thinking of other things. But yeah, you have the right tools right in front of you. You have your brain and your hands. Yeah. So thank you very much. It has been a wonderful presentation, and I want to thank everybody for joining us today. Dr. Tal has various ways that it has been trying to improve healthcare in low-resource regions, like through the Dr. Tal Foundation. We're able to act directly in the lives of communities and improve healthcare there. We have the Dr. Tal consultation, where people from all over the world are able to either get access to a physician or get a second opinion. And we also have our partners that we work with, where we're able to refer people, and also other stakeholders. So Thank you very much to everybody for joining us today. And I wish you a great week ahead.